Kids' dental benefits can be covered under your medical policy. How does it work? What does it mean? Are there tips to help you along? Welcome, I am the Medical Bill Whisperer. A previous billing manager turned patient advocate, I am committed to bringing answers, insights, and solutions to patients like you. Only children's dental benefits are discussed in this video. If you're an adult wondering about dental benefits under your medical policy, do watch my special video on that topic. But for kids, thanks to Obamacare or the Affordable Care Act, it's been at least a decade that forces insurance companies to offer pediatric dental benefits either as a separate policy or under the medical coverage of their parents as a must if they sell their policy in the individual open market or through a marketplace, or if they cover companies with 50 or less employees. So all those big companies you may have coverage under for medical services could well have your children's dental care and needs covered as well. So let's go over those dental rights for your children when under your medical policy. So medical benefits usually means anything preventive, diagnostic, or therapeutic by medical professionals. It can be anything and everything from hospitals, surgery centers, infusion centers, imaging centers, but also surgeons, PCPs, any kind of specialists or therapists, as well as drugs, devices, and even ambulance rides. Dental care is considered a completely separate portion of your body and therefore is usually excluded under the medical portion of that policy, except, again, for dependent children if their policy falls under the ACA rule. So, yay! What does that cover? It covers 3 types of services: preventive, diagnostic, and therapeutic. The good thing about preventive services is that they usually come at no cost to you, the parent. So we are speaking about 2 cleanings a year, some x-rays, sealant in the back molars, fluoride application, and an evaluation. Should the dentist find any kind of issue, for example, a filling needs to be performed, or periodontal maintenance has to be prescribed, that would fall under diagnostic. Therapeutic services, anything from oral surgery, root canals, orthodontics, and the x-rays to diagnose it all, should all be covered under that dental part of pediatric coverage. And even if services need to be used to repair cleft palate or to treat a cancer, God forbid. And even if your child must go under general anesthesia for a number of specific reasons, those should all be covered under the dental part of that policy. Emergencies are usually covered and at the in-network rate, even if you receive treatment from a non-participating provider. While cosmetic surgery is not a covered benefit, reconstructive surgery to correct or repair an abnormal structure or due to congenital defects also lead to insurance coverage and payment. If additional treatments must be performed outside of a dentist office because of a member's physical, mental limitations or general health, expect your insurance to issue a request for medical records as well as a review to determine whether benefits are payable or not. Now, because this is healthcare, there are some exclusions. For example, excessive spacing between the teeth or crowded dentitions, extractions required for orthodontic purposes before braces are placed, or any replacement or repair for appliances or braces, for example, that are lost, stolen, or broken. Dental implants, speech or language assistance devices, and more are usually not covered. Services considered cosmetic or general anesthesia or even IV or conscious sedation would not be considered covered benefit unless medically necessary, as would inpatient or hospital costs. Dental implants and the cost of any precious metal used to any kind of dental service are also excluded. Let's go over some tips to help you. First, check your policy. By this I mean, make sure your plan is covered under the mandates of the ACA. Otherwise, you may have what is called a self-funded plan, meaning it is your employer who decides what benefits are available, what is covered under what circumstances, and even whether dental coverage for your children is available, reduced, excluded, or expanded. So to find out if those braces are going to be covered, go through the evidence of coverage or call your insurance company to find out. It is best to try and stay in network. Why? Because you will be charged the full amount billed should your child receive dental services from an out-of-network provider, regardless of how much your insurance may or may not pay. And while emergency care should be covered at the in-network rate, any follow-up or subsequent services rendered by the same out-of-network provider can be excluded, reduced, or paid at the lowest out-of-network rate, depending on your policy, once your child's dental situation and condition has been deemed stabilized, therefore no longer an emergency. Do read the fine print. You can get 2 cleanings for your child per year, but do they need to be 6 months apart? What about sealant? Are only molars covered? Evaluations, x-rays, treatments of any kind, how often are they allowed or payable? And something else to be aware of, do you have a waiting period? Sometimes there is a 6 months waiting period, sometimes 2 years. So not rushing to the dentist at the first opportunity once you get your policy may save you money. Do inquire about any deductible that has to be met before the insurance starts making any payment on your account. And beware of benefits that may be limited by number, let's say 2 cleanings per year, or by length of time, only once a lifetime, for example. But to make sure everything is clear, ask the dentist for a written cost estimate or even a pre-authorization before any non-emergency service is rendered. This will establish first whether your medical or dental part of the policy accepts responsibility. It will help evaluate what is your final share of cost, maybe guarantee an insurance payment, but also confirm that services are indeed covered benefits. If they are not deemed to be a covered benefit, your dentist should definitely provide you with a treatment plan that includes the list of any service that is expected to be provided, their cost, any payment anticipated by your insurance, and that is even if that provider is in network with your plan. Both the office and your wallet can't avoid bad surprises down the line by doing a little bit advanced work. Should you need to contact your insurance and ask them if a specific provider or a specific procedure are going to be covered and at what cost, do so. But again, something in writing from the dental provider or office is definitely something you should request and are entitled to. I thank you for watching. And And your subscribes, likes, and comments are always welcome. Thank you.